Okay, it's Nalani Rude. Hello, hello. This is take two. I am praying that this works. So pray with me. Hopefully, we can grab her and she can jump on. Oh, I see that she's popped on. Okay, let's see. Add. Oh, I hope I'm praying it says adding. Share this out. I think it's working, you guys. I think it says adding. Come on with it. Come on with it. Oh my gosh. Yay! Oh my gosh. It's static. Holy cow. Yes, yes, yes. Okay, so
Am I
hopefully,
worth all this trouble?
oh my gosh, you are worth it, girl. You are worth it. So let me, oops, I'm off the screen. I gotta maneuver. Hold up 1 second. So those that were on before, send out your invites like crazy because you will
I
want
don't
to.
know what happened.
It's okay. It's okay. Yes, second time's a charm, Tina. Thank you, thank you, thank you. I'm Nalani Rude. I am a wife, mom to five great kids. I have been on this health journey. I've struggled with my weight issues, which led me to have two gastric bypass surgeries. So I am always in a nutritional deficit. So I am always on the hunt for the best of the best. And boy, did I find a doozy, right? We found
Yay.
a doozy. So let me introduce my wonderful friend. But not only is she a wonderful friend, this gal is fierce. She is fierce. Dr. Lita Harris, she's been in practice for 28 years in the Corona, California area. She's a gynecologist and a bioidentical hormone specialist. Let's get some drop the mic emojis on that one. And you know what? I was thinking. So here's the thing. You're gorgeous. You're smart. You're
Thank you.
funny. Great personality. Like I'm telling you, your brother Rico is smart, tall, good looking. This is like
Yes.
an unfair gene pool that we that we have here. Unfair gene pool.
You're a blessing. Thank you.
Oh
You're
yes.
gorgeous too, Nailani.
Well, I tell you what, the frenzy is real. I'm going to show you what we're talking about. It is, let me get it on. It's this. It's the HGH, human growth hormone transdermal gel. We have zero competition. It's been around for 14 years.
14 years.
But you guys don't want to hear any of that from me. You want to hear from the doctor, Dr. Harris. Tell us what HGH is and why our bodies
Mhm.
even need it.
Well, first of all, thank you so much for inviting me, Nailani. And I'm sorry about the technical
It's so
difficulties.
we roll with the
I'm
punches.
not I'm not techno savvy, so but the
It's
second
okay.
time around was a charm. I got it right away. So,
Absolutely.
um basically what I like to share about human growth hormone, we've talked about it before, but it's essentially a hormone that's secreted from the pituitary gland, which is a really small, like peanut sized gland that sits right in the middle of our brain. It's responsible for so many different hormones. So the pituitary gland secretes things for our thyroid, for our adrenals, for our ovaries and testes for men, among other things. So human growth hormone is something that's secreted. It peaks around teens, and then it goes up until about like 25, and then it starts to decline, and it regulates through another hormone, insulin like growth factor. It regulates almost every part of our body. So as we age, a lot of our body function starts to change and things start to decline. Essentially from the top of our head to the soles of our feet. That's the aging process. So if you can find a way to safely
Right.
replace that, then I think that's a bonus, because all of us want to feel good. We want to look good. We want to age gracefully, because we got a lot of people to serve. We got work to do. We got other lives to be a blessing for. And my philosophy is, why not do it feeling your best and being your best?
Right. Absolutely. You know, I talked to this gal. She's like, you know, I'm okay with my wrinkles. I'm like, oh, girl, you this is so much more than just some wrinkles. I mean, what would it
Right,
mean to you to be able to play with your grandchildren without almost this
right,
being debilitated like the next day
right,
because you're in so much discomfort? Like, what would that
right,
mean to you? You
right.
know?
And
Well,
you know something, and a lot of times I tell people the same thing. I said, you know, I understand the psychology, to be honest with you. It's like I get it, but I don't get it. I
right.
understand the psychology of people that embrace, if you will,
Yeah.
their aches and pains and their inability to sleep and their fatigue and tiredness and all kinds of other things. Some people embrace that, unfortunately. So what I say is that I'm not talking to you. If you like that, if you like
Right.
your joints aching,
Right.
if you like feeling tired during the day, if you like not being able to sleep at night, if you know, enjoy things like that, then I'm not talking to you.
Right.
I'm talking to the people who do have a variety of different things going on in their bodies and they want to do better. They desire that. So it's
Right.
first kind of thinking in your mind and saying, you know, something, I'm tired of being this way and I want to find something to help myself.
Absolutely.
So those are the people that I'm talking to. Those are the people that are welcoming. I want to say, hey, this
Yeah.
is something, I found something that can really make a difference in your life.
Yeah.
And those are the people that I'm talking to.
Absolutely.
Mhm.
Who gets that? Heart us up for that. No, heart Dr. Harris up for that one. And again, we're not saying we're not claiming to cure. We're not
Right,
attaching this to a disease
right.
process. This may help you with this
Hmm.
may help with over 41 plus benefits.
Right,
And I want to hammer this home. Like, I'm going to swing the heavy hammer on this one. It's one product. It's
right.
one powerful
Hmm.
product. One. I mean, I,
Hmm.
I I just think that is huge. Now, the next question that leads me in, why, as a doctor, did you feel compelled to jump into such a trend-setting product, a trend-setting company? I mean, you went to Cornell University. You are a hormone specialist. I mean, come on. I
Yeah.
love it.
Yeah. Well, that's exactly why.
Yes.
Because of the fact that I'm a hormone specialist. So when we talk about the different hormones in our body, everything needs to be balanced. Everything needs to be optimized, again, in order for us to feel our best. So the human growth hormone was just one aspect of this product. When I saw that there was adrenal support,
Oh,
when I
yes.
saw there was
Come
thyroid support,
on.
when I saw that there was 30 different botanicals that was in there,
Right.
all that work synergistically together to help, I that's what sold me. So absolutely. I mean, because I'm very familiar with human growth hormones, the injections. And let me just say this right now. Stop going to Dr. Google
Yes.
and researching human growth hormone
Right.
and looking at all the negative things that's there because this injectable form. Yes, the injectable form has been associated with a variety of different side effects over time. We're not injecting huge doses of human growth hormone. It's micro dose.
Yes.
This is a homeopathic blend. So it is something that gently helps your body, gently helps to stimulate your pituitary gland to do its own work, even your adrenals and your thyroid to do its own work. So if you can do something to help to support your body to function better on its own, then why not?
Right.
Why not? And so when I thought about, wow, I can do something for my patients that can help
Yes.
them get all of their hormones balanced. So, and again, this is nothing that is contradictory to using hormone replacement because I use bioidentical hormones myself. I'm on the topical creams. I saw a lot of posts about using pellets. I do pellets. I do for my patients anyways. So that's not something that conflicts. In fact, it's something that can help to augment or help everything work
Correct.
together well. Mm-hmm.
Absolutely, absolutely. I love it. And I know we've all been screaming about the HGH in it, but I'm so
Right.
glad that you talked. I mean,
Mm-hmm.
this is powerful.
It's an
There's so
awesome
much
blend.
more. Right. There's
Right.
so much more.
Exactly.
Okay, so
Exactly.
share some of your results that you have seen personally, or share something that sticks out
Mm-hmm.
in your mind, because everybody's like, okay, tell us what it does. What are we seeing?
Well, first of all, I've been on for 3 months now. For 3 months. So my
Oh, yes.
brother Rico introduced it to me, and through Jody Huganoff, Jody and Peter, and so I'm gonna just tell you that I squirted a full pump and happy dance the first day that I got my bottle, and
Right.
unfortunately I OD'd. So I used too much. I was smearing it all over my body. I was so happy and excited to get it. So, but when I finally started using it the proper way, truly energy,
Yeah.
focus, just feeling good. Sometimes it's hard to explain to people that you just feel good.
You feel good.
No afternoon slump. I get
Right.
up at 5 o'clock every morning. I don't feel tired in the afternoon. I work long days. I'm able to sleep great at night. I've had problems with my left knee for years because I had injuries when I was in high school. And so I was wearing braces and rubbing things on my knees. And every time I kneeled down to pray, I knew I was going to ache the next day. um, any exercise, I had to wear braces. I literally no more pain in my knee. I no more swelling in my knee, which is awesome. Um, I just gotta, you just feel good, like I said. So I think it's the energy to sleep. The joint pain is gone, and my hair's growing. My hair is growing. I realized that. I'm like, wow, my hair is growing as well. So that's another great thing. I got my husband on it too. He saw
Oh,
how
yes.
energetic I was, so he's using it too and feels great. Oh,
That-
belly fat. Belly fat is under control.
That's awesome. Well, to stay compliant, we will say that your hair
Oh,
looks and feels thicker and
yeah,
fuller. We're not
yeah.
claiming that it regrows
No,
hair. We got to stay
no.
compliant.
Yeah,
And I always say that if I'm 43, if I went to bed last night and I was 18 or 19 or 20 and I woke up at 43, I would be screaming. I would be like, what has happened? But because we age gradually, we have
right.
learned to, we don't notice all the changes
Yeah,
that are happening.
that's
So
right.
I'm telling you, I'm gonna fight the good fight, and you need to pay attention. We're not even a year old, and we have around 800 physicians involved.
Oh,
800.
great.
That's
That's
crazy.
awesome. That's awesome.
We love everybody. We love everybody.
Yeah,
But when
yeah.
physicians start flooding in, I mean, listen,
Right,
buckle up, friends. Buckle up. There's
right.
the gel frenzy is real. It's simple,
Yeah,
one powerful product. All right, so I know you are so busy, and
yeah.
I'm gonna give you a big plug. Get a hold of Dr. Harris. If I mean, she's a hormone specialist. Like, if you need some extra, get a hold of her. I love that. Yes, Jerry, stats don't lie. They don't. Um, what would you tell somebody that is sitting on the fence?
Well, like I started, we're not talking to people who embrace,
Right.
you know, anything negative.
Feeling
So
icky. No, thank you. I
don't.
like feeling icky.
Right, right. So no, no. So if you're kind of on the fence, I'm thinking people might be on the fence because they're concerned about, safety and things like that. So first of all, don't look at the stuff that is referring to the injectable human growth hormone. Okay, so
Right.
don't look at that and think it. So it's microdose. This is something that has proven safety. The 14 years of this product being around was also a big thing for me. It's not something new, brand new that we're just experimenting with. It's been around for 14 years, 93 to 97% reorder rate. So that was something that was very important to me. So I think if you're on the fence, I mean, I think you just need to jump in,
Right.
So if you feel that you really want to start making some changes in your overall health, and just feeling optimal, and just addressing a lot of different things that you might be dealing with. Also, be patient. Everyone
Yes.
is different. Everyone is individual.
Right.
The products work with your body. So
Right.
your body may have certain demands that it's going to address first. Don't look at everyone else,
Right.
but you got to be patient. Let it work with your body. Let the changes happen and then start looking at it and assess it for yourself. It may take a few months for you,
Right.
for you to be able to see. So people just got to be patient, but jump in. We're having a good
We
time and
are.
we're feeling good,
We're feeling
right?
good. If you are feeling great on the gel, drop your testimonial.
Yay.
Keep it compliant in the comments below.
Right.
But I tell you what, we have to work together to spread this message. The
That's
gel
right.
is for real. Don't
It's
let the
for real.
haters get into your ear. I'm telling you what, it's brought out some ugliness in this industry, but it's fear.
Wow.
It's fear. It absolutely works. You can
That's
be
right.
bold and confident in the product. It's crazy good. It is crazy good. 90s, we bobble between what, 93 to 97% reorder rate. Hey, we've got happy customers. We have happy reps. I'll
Right.
take anything in the 90s. That means
Right.
life
That's
is great
right.
over at the gel.
That's right.
Now, if you are Dr. Harris's person, get with her ASAP. Drop what you're doing, get with her and say, listen, I need more info on the gel.
Right.
Hit her
That's right.
in Facebook Messenger. If you are my people, get with me. I will take care of you. If you have been invited to this video or somebody has shared it with you, get on the gel.
That's right.
Get with them. Get on the gel. I'm telling you, we're not going away. We just keep getting more momentum. It's a snowball.
Yeah.
And buckle up, friends, because this is going to be the ride of your life. Don't
Yay.
look back, look forward. Thank you. Thank you so much for coming on. Thank you. Thank you. I love you, friends.
Bye,
Share,
everybody.
share, tag away. Have
Yeah.
a
I gotta
gel-tastic
go see
day.
my patients now.
Yes. Yes. Have a gel-tastic day.
All right. Bye, Nalani.
Bye-bye.
Bye, everybody. Take care.